I'm Dr. Yasmin, pediatric dentist at Children's Happy Teeth. I think the reason many children have anxiety is that it's the fear of unknown. A lot of kids don't know what they're going to be expecting, and it's just fear of not knowing what is going to happen. So it would really help for the parents to prepare them calmly at home, just, have a little preparation at home, maybe read a book about dentistry, maybe watch a movie about dentistry, something to prepare them, to calm them, and also for themselves to have a positive and, energy when they're coming in and feeling happy about it, because kids, they feed off their parents' energy. Some of the signs that parents might miss regarding anxiety could be that kids start acting up. They don't want to brush their teeth before the treatment, before the appointment, or they just, they just either get really quiet, or they become really talkative. They ask many questions from parents, or they just repeat a question over and over. These are all the signs of being nervous. And for parents, is just, to stay calm and to be patient with them and try to answer their questions. And just basically, making sure that the kids feel more comfortable coming to the dentist. So the way our team helps with children who had a bad experience in the past is that first we make sure everything in the office is kids friendly. So when they come to office, our waiting area is very kids friendly. We have TV. And then the way our team helps the children is that we stay calm through the exam, through the cleaning, through all the steps. We explain everything to them to make sure they understand. Because kids, again, it's the fear of unknown. They don't know what is going to happen. So if we explain everything and we show them, then it really helps them to stay calm, to understand what's going to happen. For example, we show them with our Explorer. I tap on their nails to so they can feel how it feels like when I'm counting their teeth or when I'm examining their teeth. Or for some kids, they just can't do everything in one appointment. They can't do the cleaning and the exam or the X-ray. So we just reschedule them to come back for like X-ray or cleaning. We want to make sure that they have a good experience, especially for the first appointment. For very anxious child, we make sure that we explain everything to them. So first we have our X-ray room. It's decorated for children, so they feel comfortable. We show them the camera. We show them the little films we have. That feels just like a piece of paper. We have them hold up X-rays, and just kind of, they understand what it is. Or like we show them the mirror, the Explorer, and like the chair. Sometimes they sit in the chair and they're like, "Whoa, why is it going back?" or "Why is it going down?" And we were like, "Oh, it's like a ride." So it's just explaining everything in their language so they can understand it better. Our office is very kids friendly. As soon as kids and parents walk into the office, our waiting area is decorated for children with TV and games. And then when they walk into our exam area, which is called Open Bay, we also have TV in Open Bay. They're just watching TV, enjoying their show. And the X-ray room, the open area, they're all decorated for children. And then at the end of their exam, they get a toy. So they're always looking forward to the toy part of the appointment, and it's just making the entire appointment more positive. Or they get to pick a toothbrush, and it makes them feel a bit more in control, and they feel very good about themselves when they're leaving. Parents' role is actually very important. Parents are the children's emotional guide. Children feed off of their energy, so it's very important for parents to stay calm during the treatment, to have positive energy, and also at home, having being a good model for their children is very important. Just like, brushing their teeth every day, flossing, children look up to them. They see parents are, they have good habits and they do the same. And I think those are very important. Also, I want to say that it's very important for parents not to say some scary words when they come to dentists and say, "Oh, it's not going to hurt." Talk about pain or shots. We don't talk about shots during the treatment. We call it cold water because it feels like cold water to children. So it's important that parents are also not using scary words and just they feel they're calm themselves, and so the children, they look up to them during the treatment. The biggest change that we see is that we see children being from anxious and stressed to being confident and calm and proud of themselves. When they're leaving the chair, when they're leaving the office, they just feel good about themselves. They feel confident, they're more calm, they're more relaxed. So we definitely see that change. Addressing anxiety early in life, it really helps to have a good relationship with the dentist. And the earlier we try to address that, the better it works in the future for the parents and for the children, and they have better experience with the dentist, and they have better bonding with the dentist, and they also feel more in control, and they trust their dentist better.